Hello everyone and welcome to my project on binge-eating disorder. Apologies in advance for the layout. I had some trouble exporting it to where I'd actually be able to screen record this without any issues. So that being said, let's just jump into this. So, introduction. Binge-eating disorder consists of episodes of consuming food in a larger amount that is considered normal in a relatively short time. It's important to note the distinction between binge-eating disorder and bulimia nervosa, more colloquially known as bulimia, in that these individuals will not purge. However, the same shameful feelings after binging persists, as we'll expand upon later. These episodes occur usually every week, over 3 months to be considered binge-eating disorder, to be diagnosed formally, and risk factors included with this include child obesity, conduct problems, substance abuse, and more. Symptoms. Symptoms include, as aforementioned, eating unusually large amounts of food in a specific amount of time, such as a 2-hour period, eating when full or not even hungry, and eating fast during binge episodes, like not really savoring or enjoying the food, just eating as much as one individual possibly can, in some instances, or eating until uncomfortably full. There are also some more symptoms in regards to this, such as eating alone to avoid embarrassment, like I said before, feeling distressed or ashamed, or even guilty about their eating habits, or even frequent dieting without weight loss. Recommended treatment options. As we'll see here, those who suffer from binge eating disorder have a plethora of options when it comes to treatment. The first that's recommended in most cases is psychotherapy before they try medication, as we'll see. CBT, or cognitive behavioral therapy, is usually the standard in regards to binge eating disorders, as it takes individuals' habits and has them really reshape how they approach their views on food and their thinking, and form new habits and feel less guilt and shame surrounding foods and what foods are and are not okay to consume. And it has seen some studies have shown that it is effective, and there has been improvements made using CBT. Furthermore is interpersonal psychotherapy, and DBT, or dialectical behavioral therapy. And if those don't really work, SSRIs, or selective serotonin reuptake inhibitors, or antidepressants, could be a potential route, such as weight loss treatment for someone to go. Some potential dangers are obesity, diabetes, hypertension, and chronic pain, as well as complications that come with those disorders. So yeah, thank you so much for watching, and here are my references. Bye. Thanks so much.